Good day, everyone. Welcome to the webinar, BHAP Introduces New Cigna Association Health Plan. My name is Angie Fiedler-Sutton, and I'm with the Behavioral Health Association Providers. For those of you who don't know, BHAP is a national trade membership association provides education and advocacy for behavioral healthcare providers and related entities. For more information about BHAP, you can visit our website at www.bhap.us. Before we begin the seminar, a few housekeeping details for those of you joining us for the first time. You'll be able to hear us, but we won't be able to hear you. That's because we record these webinars, so you have access to them later if you need them. However, if you have questions or concerns, you can use the chat room in the lower left. You don't need to wait until the end for questions. We'll be sending the PDF of the slides as well as a link to this webinar after the event. Now it's my pleasure to introduce our presenter today. Adam Glasgow is the Vice President of Campbell Petrie, a boutique employee benefits consulting group. Adam has owned and operated several companies from inception to eventual sale and understands the issues that small business owners are facing today. As an employee benefits specialist with a concentration in the behavioral health field, Adam has been able to help companies develop and sustain long-term employee benefit packages focusing on cost, compliance, communication, and culture. Adam, thank you for taking your time to present today. With that, I will hand the webinar over to you.
Great. Thank you very much, Angie. Appreciate the great introduction, and thank you, everyone, for taking some time out of your morning today to jump on this webinar with us. Before I get started, I just want to give you a little background about Campbell Petrie. As Angie said, we're a boutique benefits consulting group. I actually happen to specialize in the behavioral health field, work with a lot of treatment centers, IOPs, detoxes around the country, creating long-term strategies for managing their health care. Because of my specialty with the behavioral health field, the common thing that I constantly hear is, we need affordable health care. And that's a common problem, not just in the behavioral health space, but, small businesses all across the country. That seems to be, a huge, huge issue. I work with a lot of associations, and that's typically, their number one hurdle is being able to offer affordable health care to their employees, in an effort to retain and attract new employees. So, what we were able to do is partner with OutFront Health to put together a plan that we think is a viable option for the small to mid-sized employer to take advantage of a lot of the benefits that large employers around the country have been taking advantage of for years. So, OutFront Health is a subsidiary of Cobbs Allen, which is one of the largest brokerages in the country, and they've been able to put together with us a health plan called OutFront Health. And I'm going to just move over to the next slide here. So this is basically an overview of the program. I have a lot more information that I can send to you individually. We can spend some more time later if you have questions, but this is an overview, give you a good idea how this plan works. So what the OutFront Health program is, it is a Cigna level funded product. It comes with a bundled solution of medical, dental, and vision. Then there's a bunch of group life options for LTD, STD, long-term disability and short-term disability, if you're not familiar with the abbreviations. It's all on the Cigna National Network. Which means that they're all national plans. They're all PPO plans, which is a really, really great thing. All of the PBM is through Cigna, which is the pharmacy benefit manager. And a lot of these terms may be unfamiliar to you, so if they are, please let me know at the end, and I can spend a little bit of time explaining all these terms to you. So everything is managed through a TPA. So in traditional health insurance, just so you're familiar, like let's say you're using Blue Cross or Blue Shield, they are the TPA and they are the PBM. So there's really not a lot of difference in this particular plan. So for your employees, it would feel just like a regular health insurance plan. Really, that It is. It's just on the back end because it's level funded. There's some benefits to the employer. So all of the reinsurance is A-rated stop-loss paper, which is on the back end, the reinsurance. So one of the nice things is that the technology platform, it's all online for your benefits enrollment. So it's very simple, no paper applications for benefit enrollment, which is really nice. There's 8 plan options, including 2 HSA qualified plans. And then this particular plan is what's called level funded. And the beauty of a level funded plan is because it removes the carrier profits and because it's a form of self-insurance, you don't have to pay the taxes that are levied by the ACA that was put into place a few years ago. So by doing that, we're really able to offer health insurance at typically a 15 to 25% discount over what you would see in the regular fully insured market. And I can go into a little bit more detail on exactly what the actual level funded product means. So, and then you have your TPA. So one of the benefits of this program is that everything is administered for you. So they take care of your COBRA, all your claim review. They administer all the aspects of your plan, including your HRA and FSA. So it's really a bundled solution, one-stop shop. One of the things that we really like is the fact that you get one invoice. If you choose to have dental and vision and all these other insurances, they would all be on one invoice instead of having multiple vendors for your health insurance needs. So that's a little bit of an overview of the program. Actually, bear with me. I'm going to go back one slide because I think that it may make sense to help you understand a little bit more about level funded plans. So typically, most small employers are on a fully insured plan, which means that, let's just say, for sake of numbers, that you have 10 employees and each employee pays, $100 a month. So at the end of the month, you never pay any more than $100 per employee. At the end of the year, you paid all your premiums and then you wait to get a renewal. And your renewal typically is going to go up every year depending upon how the group did, or depending upon exactly where you are. If you're in a community-rated state, I'm assuming that everyone is in California, but a lot of times in these associations, we have folks all over in different states. So that's like a traditional fully insured plan. With a level-funded product, you actually are able to get a rebate at the end of the year. So let's say an employee pays $100 a month into their health insurance, just like fully insured. So at the end of the year, they've paid $1,200 into their health insurance. Well, if they never got sick that year, maybe they only spent $500 out of the $1,200 went towards their claims. So that would leave $700 of unused money that was paid into the insurance. So with a level funded program, after your administrative costs, you would receive that money back at the end of the year. So this is something that big companies have been doing for years. The only difference is that big companies traditionally do fully self-insured, where they actually pay the claims. With level funded, you will never have any more risk than the $100 a month. So this is kind of really what it is for the small to mid-sized employer to have the benefit of being fully insured, so there's no additional risk, but being able to take advantage of the larger companies, what they've been doing with the self-insurance. So you have an opportunity to get back at the end of the year any money that is not been used in the claims fund. So it definitely is an opportunity to earn some money back at the end of the year. So I hope that is helps everyone understand a little bit more about level funded, and I have a ton of information that I can send out to you after that will dive a little bit deeper into that if you have some more questions. So with this particular level funded product, you have to have a minimum of 5 employees on the health plan. So that's the minimum requirement for this program. You have to have 5 enrolled employees. So other than that, there's really not a lot of requirements other than you have to be in BHAP. You have to be an active association member. Unlike some of the fully insured plans, there's no participation requirements, and there's also no contribution requirements, which is really nice, because a lot of fully insured plans you have to have, maybe 75% or 50% of your employees take part in the program, and then depending upon the carrier, the employer also would have to contribute a certain percentage to each person's health insurance per month. So with this particular program, you're not forced or required to do any of those things, but there is a minimum of 5 employees on the health plan, and that doesn't include dependents. So 5 individual employees, it can be their families, but 5 employee contracts to take advantage of this program. So that's kind of an overview. I'm going to move over to the next slide here. So one of the nice things about this program is that it's all online and it's all built out. So this is an example of the landing page that would be built out on the BHAP website. I believe it's already there. So if you are interested in taking a look into this particular health insurance offering for your group, you would go onto this page and you could take a peek at the bottom here. If you see where it says click here, that would give you an example of what the proposals would look like, what the rate plans would look like. It's not going to be the actual price of each of your rates, but it will give you an idea of what the rate plans are. And then to start the process, you would simply click on the next link underneath that, and it would be a couple questions that were asked of you. Those questions would go right to OutFront Health secured information so no one else would see it, and then that would start the process. Dina Morris and her team at OutFront Health, once they reviewed those questions, they would send you back the information that they needed, which includes a census and then some additional information. So one of the things about this particular program that is different than traditional association health plans is that every single group is individually underwritten. So in the past, there's been different types of association health plans, but the problem with them was that the groups didn't go through individual underwriting. And when I say underwriting, what I mean is each individual or employee in the group that would like to take advantage of the health insurance, we would ask that they fill out a health application, which is about a page and a half of just general health questions. And the reason that we do that is because not everyone is let into the health into this particular health plan, and the reason for that is because we are trying to keep the rates down as low as possible. So traditionally, we are accepting about 80% of the people that apply get into the health insurance plan. We always say that this isn't a magic bullet. If you're a small group and you have some very sick folks in your group, that it's much better for you to probably stay in a fully insured market where you can spread out that risk. The reason that we've been able to keep the renewals under 5%, actually 2 and 3% over the last few years, is because we really manage the book of business and keep a lot of the if you want to call it higher risk situations off of our health insurance plan. And, this is to benefit our current members and new members and to keep the renewals down and keep the rates low. So by doing that, we've really been able to not just offer a great health plan for 1 year, but a sustainable solution for the long term, which has been something that the marketplace has lacked for a long time. So just a recap on this page, this is really where you would start the process of looking into this healthcare offering. like I said, these two links down on the bottom. So with that, I'm just going to go to the next slide. This is just a marketing piece, basically kind of walks you through what the process looks like. So you can see the first step is that you pre-qualify. That was that link on the previous page that we talked about. And then if you do qualify with those basic questions, they will send you out the request for proposal documents and a secure online tool, which will enable you to upload all of that information. The employee applications will be emailed directly to them, and they can fill those out. And so from an HR standpoint or a business owner standpoint, you would never see those applications or any of the health questionnaires from any of the employees. It's a secure, HIPAA link, so that wouldn't be an issue at all. And then what would happen within 7 days, you would get a full proposal back. You would work very closely with Dina Morris from OutFront Health, who would help you to walk through that proposal. So this is just kind of like the qualifying steps here that we would go over to get you started to get a proposal. So the next slide here is the summary of benefits. This is just an example of the 8 health plans that are offered. So depending upon the size of your group, you would be able to offer 2 or 3 of these plans. As you can see, the plans start with a deductible as low as $750, and then we go up to some high deductible health plans where, you have a $5,000 deductible. So we like to think that there is, a plan for everyone in this mix. I think you'll be able to see it. It's no different from traditional healthcare. I mean, this is exactly what it is. It's a Cigna network. You have all of the same offerings that you would have with any of your other healthcare carriers. And I do have, more detailed benefit descriptions if you wanted to look at that. So, but as you can see, there's 8 plans. These are all national plans. Some you have in and out of network benefits. And like I said, you can mix and match the plans up to 2 or 3 plans depending upon the size of the group. So this slide just kind of goes over, some of the benefits of the program. So these are all ERISA-based plans, and you have your web-based enrollment. I don't want to walk through each one of these line item by line item, but, these cover all the ACA and federal regulations and your minimal essential coverage, which is, by law has to be offered through the ACA. The cost savings, this is probably, the biggest issue, because self-funding removes, like I said earlier, the carrier profits and the ACA taxes, plus the ability to get a refund at the end of the year. We typically are saving our clients anywhere from 15 to 30%. Which is considerable, and then what we try to look at is, if your renewals have been 10 to 20% over the last 5 years and we can get that down to 2 or 3%, what is the difference over the next 5 years in that savings, right? So, 10% savings year after year, it really starts to add up when it's compounded. So we really think that this isn't not just a cost savings for year one, but a long-term solution, so you don't have to continually jump around every year trying to manage your healthcare costs, which we find is, pretty standard. We find a lot of people every single year, they're looking for different ways to control their costs. So with that being said, the next is it's a simple solution. This has already been all built out. It's all web-based enrollment. Everything is done real time. All the administration is bundled into this offering. So that's really nice. You have one vendor, all online. You have great customer support on the back end. So we think that is a really, really good solution for the small to mid-sized employer. Some of the other things that we like are the predictability, and we talked a little bit about that. So you start to really understand exactly where your money is going, because this is a form of self-insurance. You'll get your claims data, so you'll actually be able to see where every single dollar went that you spent on your health insurance every year. This is very different than fully insured, which most people are. You pay your premium every month. You really have no idea where it's going. And then at the end of the year, you get an increase, usually, and you really don't know why. So once you start using a form of self-insurance like level funded, you would get your claim history. And with that, you get an analytics program that would help you predict future spends, as well as really boil down to exactly where all of your money's going. And it's probably one of the most one of the biggest benefits of being self-insured is really understanding, where your money's going. And then once you have the data, then you can make better buying decisions the following year. Maybe you want to change your plans. Maybe you want to, after a year or two, you want to design your own plan. There's a lot of flexibility. So there's just what we like to think is this is really offering the small employer. Large employers have been doing this for years and years and years, and that's why they've been able to manage their health care costs much more efficiently than the small employer. So the next slide is really just kind of an outline of the features and benefits. So this is, like I said earlier, a very comprehensive program where everything is built into one online portal. So everything is managed from your RX to the applications. You have a single sign-in for dental, life, and vision, all of your plan documentation, all of your COBRA, HIPAA, HRA, and FSA administration is all taken care of for you. So it really, really is a one-stop shop for all of your health insurance needs. And you have the multiple carrier benefits platform, so you don't have all these different websites every single month you have to go to pay all of your invoices, or to delete people, add people. So it's really a very robust system. A lot of larger companies are using HRIS systems that do something similar, but they're super, super expensive, and a lot of them won't even work for groups that are under 100. So, we think that really what we've been able to do is put together a program that really helps the small to mid-sized employer compete with the larger groups on offering benefits that are, Fortune 500. It's really difficult to get good people if you don't have a good benefit package, and just we've found in the past that that's been the number one hurdle of the small business owner all around the country, is being able to compete with the larger employers on offering benefits to their employees. So, this is just an overview of the program, and like Angie said, I'm always available to answer any questions. You're going to get a recap or this actual PowerPoint presentation sent out to you. My email address is on the last page. It's adam@campbellpetrie.com, and I'm always available to answer any questions. It's a really, really simple process that starts on that one, on the web page that we talked about before, that link, and that'll connect you directly to OutFront Health and Dina Morris and her team, and they can answer any questions, or myself. So that's kind of the overview of the program. It is about a half an hour presentation, almost to the minute, so I hope that was helpful to everyone. Some of the takeaway points here is, you have to have a minimum of 5 folks enrolled. You're going to be really getting a level-funded product, which is a form of self-insurance without the risk. It's the Cigna PPO National Network, and it's all online, single sign-on. So I hope that helped everybody get a good understanding of the program. You know, if anyone has any questions, I'll hang on here for a few minutes. I don't know if Angie opens up the phone line or if it just goes to, through the messaging app. But like I said, I'm also available via email, which is on the last page here, adam@campbellpetrie.com, to answer any questions. And one last thing, you can start this program at any time of the year, so it's not like a 1-1 renewal. You're more than welcome to start at any time of the year. We ask that you give about 30 to 40 days from starting the process to the actual open enrollment, just to give everybody time to get the applications in, get everybody set up properly. So just something to keep in mind if you're considering taking a look at this. I always suggest, go through the process. It's super, super easy, and take a look at what the rates come back compared to what you're currently doing, and I think you'll be pleasantly surprised. I think, and like I said earlier, the savings are not just in year one. They're compounded when your renewal comes back at 2%, when you have your claims data and you're getting a refund at the end of the year. So once again, thanks everybody for your time. I am available by email or phone if you have any questions, and hope everybody has a good afternoon. I'll hang on here for a minute or two and see if I get any questions on the message, and that's it.
Yep. If you have any questions, please indicate in the chat room. While we're waiting for any final questions, I want to thank again Adam Glasgow for presenting today. Thanks again for those of you attending. A reminder that a PDF of the slideshow, along with the link of the presentation video, as well as a direct link to the benefit, which I also put in the chat room, will be sent out to you via email in the next few days. Any questions? Going once, going twice. Looks like not. We hope you join us for future BHAP webinars.
Okay.
Adam, thank you very much. This concludes today's webinar.
Thank you.
Thanks again.
Have a good afternoon, everyone. Bye-bye.